Welcome to Through the Drama. Chris Harrison and Lauren Zima with you. And LZ, we're going to dive into a topic today that has dominated the headlines. It's really dominated everybody.
Dominated our lives.
And it's weight loss and the weight loss drugs, GLP-1s, Ozempic, Wegovy, all the names that you're hearing and you see in every commercial.
And you see on everyone you know. I mean, that's why you and I really wanted to talk about this, because we see celebrities, Meghan Trainor, a bunch, I can't even list all of them.
Every red carpet you ever see.
Almost every one of the Real Housewives, as much as I love them, on these weight loss drugs. But also, we are now seeing kind of everybody in our neighborhoods on these weight loss drugs. I went and looked it up because I wondered, why has it boomed so much in the past couple of years? So Ozempic was always used to treat diabetes for many years.
Right.
In 2021, it'll be 4 years in June 2025. So in 2021, Wegovy, the other version of Ozempic, was approved by the FDA for weight loss. Since then, all these other drugs have popped up. But truly, in these last 4 years, we have seen the explosion because the approval changed. And we were talking to a friend of ours the other day who runs a medical company, and she said she thinks not only will everyone be on it, she thinks everyone should be on these drugs.
Well, right now, the self-reported data is 6% of the population is on one of these drugs. And that's self-reported, so the number is actually higher than 6%.
I mean, I read an article the other day that these companies want millions and millions of people to be on it. So the question is it more than weight loss? Is it for our health? Should we all and will we all be on these drugs? Is it the new gym membership? And to answer that, we wanted to bring on an expert we trust. So please welcome to the show a woman who is double board certified in internal and lifestyle medicine. She is the lead physician over at the Medici Executive Healthcare Center here in Austin, Texas, and an associate professor at Texas A&M. Dr. Vo, thank you for joining us.
Thank you so much for having me.
So we wanted to go to someone we knew and trusted on this. You are our doctor, so thanks for being here. Dr. Vo, when you hear, like, our kids both go to TCU, one just graduated, and let me give you an example. We're hearing from our college-age kids that they know many, many college-age kids on these weight loss drugs. And in my mind, I think of a 20-year-old as usually pretty fit, although I know in America we overall struggle with that. My first question is, should people be on this at that age? How young should you be on a weight loss drug?
Yeah, that's a great question. So I'm going to speak to what it is approved for. And I will say that when we're talking about Ozempic, we're talking about GLP-1 agonists. So that's the class of drugs. And there's so many. So it's not just Ozempic, and they all kind of sound like Star Wars name. But the FDA had approved liraglutide, which is a GLP-1 agonist, for the ages of 10 years old and older. And the approval is for diabetes treatment. Now, Wegovy, which is semaglutide, the FDA has approved for 12 years old and older. So that's really the youngest that we're seeing these getting started on. Now, for weight loss, it really is for the severely obese. So we're talking about 95th percentile in BMI, right? So it should not be used as an aesthetic drug in the pediatric population.
But it is. I mean,
the numbers are staggering. 594% increase in adolescents and young adults. This is 12 to 25-year-olds, doctor. That just, and maybe it's just me taking a stand here, but it just seems insane.
We just saw Kyle Richards on The Real Housewives of Beverly Hills. Her daughter just made headlines because she's 24, 25, and I watched her on the show. She's a fit, beautiful young woman. She made headlines saying she was on weight loss drugs and her hair started falling out. So I look at pharmaceutical companies skeptically and think they want a lifetime customer. But they're also making the argument that these drugs help with reducing heart attacks, with reducing stroke, reducing Alzheimer's. And I even know a friend of ours in town who says she thinks everyone should be on it from a health perspective. Can you help us understand that?
Yeah. So two things you're asking. Someone that isn't obese or overweight, what is the risk of using that? And then the second question is, should everyone be on it for cardiovascular benefit, right? So I'll answer the first question, being that we know that what these drugs do is it affects both the brain to in our satiation centers to make sure that we feel satiated when we're eating or just living our lives. It acts on our pancreas to regulate insulin sensitivity, and it acts in our gut to kind of delay digestion. So in essence, you lose weight because you're calorically restricting, and that's how you also bring down inflammation, right? But what happens if you're still eating the same diet, which is not a great diet, and you're just eating less of it, you're not getting the micronutrients you need. So you end up, she experience hair loss, but you could have hair loss, you could have dry skin. So all the symptoms of lack of micronutrients, right? So that's the part that patients don't understand, that with the weight, you're also limiting your access to nutrients. Your question about the cardiometabolic benefits and it should be used on everyone. There are two huge trials that were, kind of big trials in the landscape of bringing these drugs to the question of, do they have a health benefit, especially cardiovascular benefit outside of just weight loss? And in fact, they do, but there's a caveat, right? So when we're talking about Ozempic, which is semaglutide, this was the SUSTAIN 6 trial, really large randomized control trial showing a decrease in major adverse cardiovascular risk of about 26% actually in this patient population, even before weight loss. And this was in a population with diabetes and very high risk cardiovascular disease. So you can't apply this population, the study population to the general population that might not have that risk. For tirzepatide, which is Mounjaro or Zepbound, that trial just came out in November 2024. It's called the SUMMIT trial, another very large trial showing decreased cardiovascular risk. But also these were in heart failure patients that were obese, so I feel like this medicalization of this, weight and hunger, and of these GLP-1s, people saying, should it be just everywhere? Should it be a supplement? This is not unlike things that have happened historically, like the statin drugs. I wasn't practicing when statins came out in the 80s, but my dad was. He was an internist. And I remember him being really excited about this drug, and exactly that. There were lots of people pushing for it to be in the water system because it could drive down cholesterol, and that's what Americans were suffering from. Everyone thought it would save lives, and surely it has, but it hasn't made us healthier. It has not. So when we're talking about these GLP-1 agonists, although lots of great things that they're doing for folks to put out the fires in our bodies of obesity, there are side effects that come with it. We don't have the longitudinal data, so I would really caution mass use of it.
Visiting with Dr. Vo about Ozempic and all these GLP-1s, what are the repercussions? And if we're heading out to the beach and you just want to lose that 5 pounds as you're heading on vacation, should you get on it? And if you do, is it a lifetime sentence? All these answers coming up next. Welcome back to Through the Drama. Joining us today, Dr. Vo, to talk about GLP-1s, Ozempic, and this craze that has taken really the world by storm. Dr. Vo, I've just always had this theory that when you throw a rock into a pond, there is a ripple effect. And that if it seems too good to be true, it usually is. What is the ripple effect? There has to be something that this does.
We're hearing about side effects. I see headlines like Ozempic causes blindness. And I do remember hearing another doctor say part of the problem is we have not had a lot of years to look at how these drugs affect people who weren't diabetic. We don't have a lot of info on that. So can you speak to the reality of the side effects, Dr. Vo, and what we're starting to see? And do you have any fears about what we might see in the future?
Sure. Yeah. So I've experienced side effects from what my patients tell me, both in the inpatient setting in the hospital and in outpatient practice too. But really the more common ones are nausea, vomiting, constipation. And it could be very severe to the point where, a patient could develop pancreatitis, inflammation of the pancreas, retching, where they need to be in the hospital where I took care of them. Blood sugar being too low, so hypoglycemia. In the outpatient setting, kind of less severe symptoms, of course, but I also see patients that have what we call anhedonia, or just kind of this lack of wanting to do anything, all the way up to anxiety and insomnia. So because it hits on so many receptors in the body, and probably more that we don't know about, I think my fear is we don't know enough about it to mass prescribe it without the clear indications.
Dr. Vo, I have heard people say, a lot of women say, look, I'm going on vacation and I'm going to jump on this so I can lose a quick 10 before I hit the beach in my bikini. Would you ever prescribe in that way of a quick fix?
I do not. Yeah, I do not. When I'm very intentional when I prescribe these medications. And so we have a conversation, it's commitment. When I start patients on these medications, they're following up with me every 4 weeks to track their weight, their muscle mass loss, or if they're maintaining. So just to lose 5 pounds is not worth it, in my opinion.
I think what I wonder is, can you ever get off it? Again, I know that companies want a lifelong customer. They're making money off these drugs. And I will tell you, I know a lot of people on these drugs. I don't know a lot of people who have been able to get off of them. Like, they lose the weight, they try to get off, they start gaining it. So they go, oh, now I'm on it for maintenance. So is it possible to get on them, lose some weight, and then maintain that? Or is this a lifetime drug no matter what?
Yeah, they have seen in the data that patients that are on this drug that get off the drug regain 2/3 of their body weight back, and mostly in fat. So the muscle that they've lost is lost. So without a comprehensive lifestyle program, training the patients to consume protein and do strength training, they will have a really hard time getting off this drug and maintaining their weight.
And I think, Dr. Vo, would you see that as being one of the biggest problems is how all this stuff is being applied and who's prescribing it and how it's being kind of administered and these patients are being taken care of, as opposed to, a housewife or a house husband just takes it back home, does it, and goes about their merry way. And that they're not really worried about exercise routine, what the supplements they're taking, et cetera.
Well, especially with young kids, they're not thinking about, if you're in your 20s, I didn't eat well and exercise well in my 20s. I stayed up till 2 a.m. and had Taco Bell with my friends,
Yeah, that's the danger. And these drugs, you can find them on the internet, basically, through these internet sites that are selling them for experimental purposes. And I'm really afraid that people are getting access to them that way instead of through an intentional conversation with their physician, especially who someone's looking at all the sides of their health and how they're moving, what they're eating, how they're sleeping, how they're managing stress. So it should be a conversation, it should be prescribed very intentionally through a board certified doctor.
Well, I want to talk a little bit about our culture, Dr. Vo, the culture around weight, and especially for women. This op-ed in the Free Press, this woman basically said, I don't need to be on Ozempic, but I want to be on it. And she talked about how, and I understand this as a woman in our culture. In the 90s, it was heroin chic and everyone was so skinny and eating disorders are a major problem in America. And then now we moved into embrace being curvy. Oh, but now with weight loss drugs, nope, you better be skinny again. And stuff like Slim Fast and lean cuisine had been part of her diet forever. And she talked about this drug, she said, is giving her the freedom comparatively to what the birth control pill gave women. That, with all the bad food around us and all the diet culture, we can finally be free and healthy and happy. And I just wanted your thoughts on that, because is this really an American problem, the world over? Will people be using weight loss drugs like this and free everybody? Or is this something we need to address in America?
Yeah, I think obesity is a problem of the modern era, just living in an environment with too many temptations and a food industry that really is out to just get us to eat more of the food they're making instead of foods that are healthful for us. So it is, more prevalent in America, but I think it will spread just like we've seen obesity spread all throughout the world when there's been more access to processed foods and fast foods, right? But this question of being over medicalized is not new. We look at the aesthetic world with dermatology and all the standards in anti-aging these days. Are we not meant to have wrinkles at 40 years old anymore? So I think the choice will always be up to the patient and really up to your values. If you value living in a healthful body and doing all the things you can to stay vital and full of energy, or do you want to just biohack and use supplements here and there? I feel like many people will be on these drugs, just like we've seen with statins and metformins and even Botox. But is it the right thing to do? And my opinion is no. I mean, there are many lifestyle factors that play into this. And if we optimize those factors, we can live free of being tied to medications and supplements and all these biohacking efforts.
Well, Dr. Vo, when you look at the numbers, the females, 12 to 17 years old,
yeah,
the use of this drug has gone up 588%. And I had a young daughter who went through the hormones and the changes in their teenage years and all the angst and everything that comes with it.
And all the body judgment.
And the body judgment, it just seems like this is so damaging and so harmful now to be like, well, here, you can just take a pill, and throwing this on top of what's going on in their bodies, it just seems insane to me.
But then also as a woman, how do you keep up? Like,
Right.
I will say, I look around at people we know here in Austin, and when everybody's on it, I had somebody who's my exact age the other day tell me, "You're not on it?" And I said, "No." And she's like, "Well, I don't know why you aren't. You need to get on and get on the right one." And it's very hard to keep up.
Yeah, yeah. It's one of those things where you have to ask yourself, is it worth keeping up? You know, who am I trying to impress? And that will always be a personal question.
Oh, Dr. Vo, that was deep. I'm going to keep that with me. You're so right. Well, I just want to ask you for the record, because this is what we wanted to address today. Mm-hmm. We're hearing from medical friends of ours that these GLP-1s are such a healthy wonder drug that everyone should be on it. Should everyone be on GLP-1s?
Yeah, absolutely not. We don't have the data to show that everyone should be on it. We have the data to show that when your body's on fire with severe obesity, uncontrolled diabetes, yes, you will have cardiovascular benefits from it. But no, it should not be for everyone.
Dr. Vo, the final word on GLP-1s and Ozempic. When we come back, LZ and I are going to put our final stamp on this debate. All that right after this.
Welcome back, everybody, to Through the Drama. Thanks again to Dr. Vo.
Yeah.
She really gives that, like, she's just straightforward, you know? But I have to be honest, was I being too hard when we were talking to her? I do want to watch. I think I went into this with the suspicion that no, we shouldn't be all on it, because the way that I was raised, my mom was we don't take any medicine unless we really have to. So it's hard.
And I feel the same way.
But some people aren't raised that way.
Yeah.
And I want to be conscious of, like, maybe it is great for everybody, but it didn't seem like Dr. Vo felt that way.
She handled it from a clinician standpoint and felt very clinical in explaining it. And I think this is tough because it's an emotional issue. And that is where we get into this tricky part where you have big pharma and the pharmaceuticals that are going to play on these emotions that really run our culture right now, which is our body image, and especially for young women. And I think that's where it's very damning and very tricky.
And we are all up against some emotional, but also very real physical struggles
Right.
of our food being engineered to be addictive in recent
Yeah.
decades. Food being all around us, available all the time. You know, we get emotional comfort from eating. Different foods release dopamines in our brains. So it's this cross of emotional, physical. I also know, do you know any guys on these weight loss drugs now?
I do. Yeah. And that's it. I mentioned women because, I think young women, I have a near dear to my heart because of our daughter, but men have also increased over 500% their use.
500%.
Young men. Yeah.
Listen, I don't want to discount the incredible life-saving properties
Right.
that these drugs have, not only for people with diabetes, but for people just, again, our food is addictive and it's difficult and people can have trauma responses with food. And then before you know it, you're really struggling health-wise, and these can be life-saving.
We keep talking to doctors about this, and hopefully we will continue these conversations because I want to leave room that I could be completely wrong about this. And I
Yeah.
think that's why you have to debate all this. But right now, my stance is, in the history of mankind, in the history of medicine, there's never been the magic pill. We've always thought that. When we put people on speed and all housewives were hopped up on speed, there's been all these things where we thought, this is the magic elixir, this is the fix-all. And that's never in the history of our world been the case. And I just think 20, 30, 50 years down the road, are we going to have this moment of, boy, were we idiots that we thought this one pill, this one drug was going to fix everything.
Well, honey, I have news for you. It is expected that these weight loss drugs will be more popular in not injection, but pill form coming this fall. So maybe it will be the magic pill.
What do you think?
Well, okay, so this is revolutionary. I would put these on the level of Viagra, of the birth control pill. They are proven to be twice as effective as any weight loss drug in the past. They're being looked into, could they be effective for treating addiction? Because it kind of numbs certain, desires in your brain. I agree that I just don't want to be on a drug the rest of my life unless it's something I really have to be on. Like, I was not raised to think that was okay. I think that our culture in America is an over-prescribing culture and that we do turn to pills. I was thinking about that docuseries, The Blue Zone on Netflix.
Right.
It explores different cities in the world where people live very healthily, not in a nursing home, very healthily and actively into their hundreds. And in Japan, they explore why. One of the philosophies in the Japanese culture was only eat until you're about 80% full. It's part of their culture. We don't do that in America.
No.
And I think we have to make some cultural changes, but we often treat those cultural needs with a pill.
And I just always go back to, and you and I are very much aligned on this, on the ripple effect. If you throw a pebble into a pond, there's a ripple effect. And with medicine, if you take one thing, it's going to have an effect. It will counterbalance. This debate will rage on. Elsie.
I don't think we even know about all the side effects yet. Like I said, I see headlines about it's causing blindness. I mean, it does make you lose muscle. So I'm also skeptical just because we don't have that much research available.
Our thanks to Dr. Vo for chiming in. And
I think we'll have more people on to talk about this.
For sure.
Yeah.
There is so much more to talk about. And there's so much more to talk about you. Thanks for joining us today. We will do this every weekday right here on Merit. And you can find us wherever your favorite podcasts are found. Until next time, we'll see you.
Hey, Dr. Phil here. My network, Merit TV, has it all.
Now, let me blow your mind.
Merit TV's got the news that matters.
The selection of a new pope.
Entertainment you crave.
Busted.
Everybody in good mood today?
And live events.
Surprise. What am I, chopped liver?
With serious punch.
Big shot!
Go to merittv.com and download the Merit TV app today.